Good morning and good afternoon for those different time zone. Welcome to today's webinar by Bumrungrad International Hospital. And just to welcome my co-host will be Patrick today. I'll be the host for this session. We'll also be welcoming attendees. We have partners from different areas, and also I'll be also welcoming my colleagues that will be attending this webinar for learning, and of course just to better understand what Bumrungrad offers in terms of services, and also to better understand the history and anything else that our facilitator Laura will be able to relay to us. Welcome, Dr. Laura, to this session.
Thank you very much.
Yes.
For having me today.
You're most welcome. So quickly, I think I'll also ask for anyone that will have questions as the session goes, please drop in your questions in the Q&A so that we can be able to get them once we have the Q&A session running. So a quick intro on Bumrungrad. A quick intro is that Bumrungrad is a quite mature institution in terms of healthcare facilitation and also healthcare and medical services. Established in 1980, it is one of the biggest hospitals in Southeast Asia, with attending to over 1.1 million, an average of around 3,000 patients per day, both inpatient and outpatient. And most of them, you'd find 500,000 international patients. It has various accreditations, one being the JCI accreditation from the year 2002. It has also accreditation for CAP, ANCC, GHA, which are mostly acquired as one of the first outside USA, outside the Asia, and also within the region, and also multiple global healthcare and travel magazine awards. In terms of staffing, it has over 1,200 physicians and dentists. It has also over 900 nurses, with supporting staff and administrative staff of about 4,800 and growing, and also over 150 interpreters to support communication for international patients. Of course, this is very vital because being on a mission to be the most trusted healthcare and wellness destination globally, it is essential to have such positioning in terms of staffing and in terms of accreditation. And also it operates 62 specialty centers in support of the inpatient and outpatient services, which I think Dr. Laura might delve deeper into. As well as also for referral partners, it will also be essential to know that for your patients or potential patients that you might want to refer to Bumrungrad, they also support with the visa support. So there's embassy assistance. There's also a counter for extended visa stay. There's also a coordination for healthcare insurance for those who have international insurance plans. And there's also a concierge for the VIP airport transfers and what have you. So just quickly, I think my colleague Patrick will take us through introduction to My One Health.
Sure. Thank you so much, Zach, for that warm introduction of Bumrungrad. So my name is Patrick Oyugi, and I lead the acquisition team for partners at My One Health. I'm excited to welcome you all to this exclusive webinar, where we'll explore one of the world's most trusted hospitals for international patients, that is Bumrungrad International Hospital. For My One Health, we are a digital platform that is dedicated to helping patients across Africa and also the globe to access world-class healthcare. Founded in 2018, we have assisted over 50,000 patients globally and also partnered with more than 350 hospitals to ensure that this assistance is as seamless as it's supposed to be. Whether it's a second opinion or a complex surgery or even a follow-up care abroad, we help patients connect to the best from the right hospitals and also specialists globally. Our role is actually simple, to make the quality of healthcare accessible, efficient, and also personalized. Through these partnerships, with the leading hospitals like Bumrungrad, we support both patients and also the referral partners in navigating the international care with confidence as well. Thank you so much, Zach. Now on to the next segment. I am going to introduce Dr. Laura to walk us through Bumrungrad. Dr. Laura.
Dr. Laura, I think you can share your presentation and then we can begin.
Oh, my apology. I was disconnected for some reason. Not sure why. Can you hear me now?
No problem. Yes,
Okay.
yes, clearly.
Yeah. Okay, thank you. I hope it's not going to happen again. Right. So thank you so much for doing this introduction. It was very comprehensive. I think it will save some time on my presentation as well. So can you please help me how I can share my presentation?
Yeah, just at the bottom panel, I think this, you can see hand raise and next to it, there's share.
Yes, I see it. Okay,
Yeah,
good.
yeah, perfect.
Good. Just a moment. I will share my presentation in a minute.
No problem.
Okay. Okay. All right. So can you hear? Can you see it right now?
Yes, we can.
Okay, great. Okay, so let's start then. If you have any questions, please keep them until I finish, and then we can just discuss. So actually, I prepared a few presentations. One is about Bumrungrad in general. Then I have 3 presentations about our 3 centers of excellence. Unfortunately, we cannot talk about all our centers, so I just selected 3 of them. So, as a owner and operator of multiple healthcare-related entities, Bumrungrad is quite famous in the region. So, here are some of us inside and outside of Thailand. Right, it's already been presented. We have 1 million of patients a year, and half of them are international patients. So what's important that a lot of our doctors are quite famous and they're internationally renowned, and some of them they have extensive overseas training and have experience from USA, UK, Australia, Germany. They have over 300 US board certified doctors, and they cover more than 100 specialties, subspecialties. They have a lot of professors from the top teaching hospitals. So it's kind of that our doctors team is one of our strengths. So accreditation and awards already been said. So we were the first in Asia to receive GCI accreditation. So probably I will only talk about the Newsweek award. So we actually, for the 5 years, we were ranked as a world's best hospital. And for this year, we're in the top 100 best hospitals around the world. And also we are Best Smart Hospital for 4 years. Also we received award as a APAC Best Specialized Hospital for 2023-24. And we named as Asia's top private hospital this year. Right, so this is our hospital. Actually, if you've never been here, so it's one campus, 3 buildings. It's quite large. So we have like 580, include all types of intensive care, exclude regular ward. Also, we are capable to serve 5,500 outpatients per day, and our hospital building has 41 operating theaters for different specialties as well. Right, so this is our inpatient rooms. You see they're quite they actually have a variety to cover all needs of our patients, their preferences. This is our VIP suites, double rooms. This is our royal suite for 2 bedrooms. So
Laura,
yes,
just
yes,
were you presenting
yes.
something? Because I think we are all just seeing the slide for Center of Excellence. We are not seeing anything else that
Oh,
you'd like
really?
to
Oh,
maybe see here from your end. Yeah,
okay.
yeah,
Let me.
yeah. I
Thank you for
think, yeah,
telling me that.
perfect. Thank you.
Okay. How about this? Can you see now?
Yes, you can now
Any
see the slides
difference?
that you're. Yes,
Okay. And the next slide, can you see next slide?
you have to select it. We are still on the Newsweek awards.
Okay.
Yeah, now,
Yes.
yeah. So I think you'll keep
Okay.
selecting the slides as
So,
we go. Yeah,
oh, I see. So it's not
yeah,
right. It does not.
yeah.
Okay. Can you see the next slide after that? Can you see inpatient rooms?
We are currently seeing the heart of Bangkok, so probably the patient room should be slide 9. I can see from
It's for
the
some
side panel.
it's for somehow does not slide in between. All right, I see. All right, never
I,
mind. Let's do this way.
yeah,
I'm sorry, it's not gonna be pretty,
mm,
but at least you can see. Okay.
no
All right.
worries.
Let's try it this way. It's okay. All right. All right. So what can you see it, right?
Yes, we can see slide 8. Yes,
And next slide, inpatient rooms.
not yet. Probably you'll select it
You cannot see.
manually manually on the left-hand side of your desktop. I think you just click on it so
I
that you
see.
can be able.
All right.
Yeah,
Let's do next. Yeah. Let's not
yeah, yeah,
waste our
yeah.
time. All right. Okay. So inpatient rooms. So if you see, we have a variety of rooms for our patients, right? So to cover all their needs, all their preferences. So we have premier suites, we have VIP suites, we have the 2-bedroom suites. So everything based on our patients' needs and preferences can be covered. All right, the next one, the very strain we have, it's our innovation in technologies. So Bumrungrad tries to integrate and incorporate the latest technologies into our routine. So if you see precision medicine, it's a very important part because our oncology center is specializing on precision medicine to treat cancer patients. Also, we have next generation DNA sequencing technology. We're the only private hospital in Thailand who has this technology, right, for genomics and genetic testing, which we do all in-house. Also, we incorporate radiology AI. It's Lunit inside. So it's for a few years already, and it helps our radiologists to make their to make all those findings and do it accuracy. Accuracy is quite high for the finding early signs of cancer. for example, right? But it's not only cancer, it's about any findings. Robotic assisted surgery, Da Vinci, Macroplasty, so we incorporate all of them into our routine. Also, we have cardiac arrhythmia lab. It's Cardio Insight. It's the only one in the region. It's very special. Telehealth. And also we have other types of technology like Urolift, like IceCure, Resume, Hydrogel. And this year, we became the first hospital in Thailand to have the new machine. It's Photon Counting CT. Also, we have one domestic referral office on Phuket. For the patients from Phuket, the Thai patients and foreigners and tourists as well. And the Phuket, at the moment, it's on construction. We are building 200 plus bed boutique hospital and advanced diagnostic center. So it will include Vitalif already opened there, but it will be more than that. It will be cardiology, orthopaedics surgery, and cosmetic surgery, and urology, and other menus. So this is how it's supposed to look like in the future, right? And this is our site, if you see there. All right, so it's quite close to the Phuket International Airport. Very convenient. Yes.
You stopped sharing, and I think we lost you for a while, but I think we can just continue. Maybe just share the current slide. Current slide that you
just a
are
moment.
showcasing. Yeah.
Just a moment. It's a
No
little
problem.
bit. Yeah. Just a moment. Screen. All right. Okay, can you see now?
Yeah, it's loading. Just give it. Yeah, perfect.
Okay, so this is our project, right, on Phuket. It's future home of our 200 plus bed boutique hospital and advanced diagnostic center in Phuket. It's already Vitalif is already functioning, but other centers will be opening soon as well. So it's located close to the Phuket International Airport, very convenient for tourists, very convenient for the expats. So we are just in the process of it's in construction at the moment. It's under construction. So this is the patient journey, right? So we try to make it convenient for our patients. So if you see, like, if patients, like, we prepare all pre-arrival, then arrival to Thailand, right, with hospital care, payment, and departure. So it's very, very simple. So patients send their inquiry to different channels, to our website or embassy, to the embassy, to referral office, and then we arrange everything from our side. And also we have telemed option, telehealth option. So with telemed request, and we send confirmation and deposit payment link after the deposit paid. So we send the telemed link, so teleconsultation after it's done, so the final payment link. So it's very easy. And the telehealth is a good option for patients who are planning to have treatment, but they are not sure, they would like to have ask some question before they come to Thailand, right? So now the international patient support. So we provide everything. So start from the airport with pre-registration, with transfer from the airport to the hospital. Also, we have the medical team, sorry, the international physicians and nurses. So 25 plus doctors and nurses to help our patients here. International patients here in the hospital. They arrange a lot of things inside the hospital. So this is your team if you need any treatment plan for your patients. And also we have 200 plus cultural support and interpreters for 20 plus languages. This is no extra cost for patients. So this is from our hospital. We provide the interpreting service to our patients for free. And of course, we have medical transport services. So it includes everything. So it's 24/7. We provide evacuation, repatriation, the ground and air transportation. We have the medical escort. We can provide medical escort, and we can just receive the initial report and just prepare all papers on our side. All right, this is about our services. All right, and the next one I will try. I cannot send you my presentation, so I will try to share as well. So let's talk about one of our centers of excellence, which is Heart Institute. All right, I'll try to do it as quick as possible. So to cover our time. All right. Okay, here you go. All right, so let's talk about Bumrungrad Heart Institute. So the Bumrungrad Heart Institute vision and mission is to provide a comprehensive range of treatments and the best possible treatment outcomes for patients and for all types of heart diseases. So if you see, we just stand by 7 pillars of heart disease care: coronary artery disease and cardiac arrhythmia, structural heart disease, heart failure, congenital heart disease, cardiogenetics, and preventive as well. So in our center, we have around like 8,000 inpatients a year, and we provide like around 1,000 cardiac coronary intervention a year. We have 23,000 outpatients a year, and over 180 electrophysiology complex cases a year. And also, we're the only private hospital in Thailand who provide a heart transplant as well. And since we opened the program, we already have 4 successful heart transplants. And actually, for heart transplants, this is also available for international patients. Okay, Heart Institute services, we have specialized centers and programs. So Complex Coronary Intervention Center, Arrhythmia Center, Heart Valve Center, Heart Failure Program, and also have heart transplants program, cardiovascular thoracic surgery, congenital heart disease, genetic heart screening. So dedicated facilities include everything what we need to treat all type of the heart diseases. So the cardio cath laboratories, cath lab, surgery with operating theaters, and also telemetry monitoring unit, EP lab, which is electrophysiology lab, and also we have the intensive care for coronary care, and all types of the diagnostics as well available, including the coronary CTA. Right, moving on. So the Heart Institute technologies. Right, we provide, because we cover everything, right, pretty much all heart diseases, all range. So we have this special technology for all of them, to be able to take care of all of them. CardioInsight, it's non-invasive 3D mapping system to treat arrhythmias. So we're the only center in the region, and with this kind of technology, it's very special. And actually, the closest to us a lab like that is in America. So it's the only place, it's a special place in the region. Why it's important? Because CardioInsight gives us opportunity to treat very complex cases for arrhythmia, and especially then patients already maybe underwent some of maybe ablation 2 times or 3 times, and it did not work. But our doctors, they know how to treat those complex cases. Also, we do device implantations, of course, and we provide remote monitoring for our patients when they back home, and TAVI valves too, because TAVI is one of the minimally invasive procedure, and heart stents as well. What else we have? Yeah, so remote monitoring and EP lab. So everything to cover all treatments for the variety of heart diseases. So here we go. So if you see like the year, we have kind of big number of cases, and also we have very good success rate. So compared to benchmark, our, for example, success rate for coronary artery intervention is 99.2. US benchmark in it's 95. And as well, like the complications, we have only 0.4, and US benchmark is 2.65. So it's quite good results we have. All right, here the cardiac arrhythmia electrophysiology. This is Professor Dr. Kulavi. He's one of our, he's a director of the Bumrungrad Heart Institute. And Professor Dr. Kulavi, he's the very famous, with like worldwide famous electrophysiologist, and he's a pioneer of the modern electrophysiology of heart. So if you have any case of arrhythmia, he's the right person to send your patient to us. So again, success rate very high. We have like 100% success rate. We have low complication compared to US. Right, so this is kind of amazing place for people with arrhythmia to diagnose and treat them. Right, next one, structural heart disease. So it's sorry, valvular heart disease, and we have like as well, we provide TAVI, which is like minimally invasive procedure. Okay, moving on. So here we are. Yeah, and here where we see like we have like the for the vascular approach, right? We have like 100% for TAVI, right? We have 100% success, and for 0 complications as well. Okay, moving on. So this is advanced heart failure and heart transplant. So as I said, we already have 4 successful heart transplants. But to be able to went onto heart transplant, the patient should be registered to the heart failure program, right? And actually, our heart failure program quite successful. We have like a 1-year survival rate after heart transplant. It's 100% with 0 complications. So moving on. So coronary bypass surgery as well, we offer that with good results, with 0 mortality rate, with the very low for the post-op stroke, and so 0 actually compared to benchmarks in America, for example. All right, moving on. Okay, congenital heart. So basically we do the all types of services for children, right, with the heart defects. And also in Bumrungrad, we have the Ragja Thai program. This is Healing Hearts. This is a program provides surgery to unprivileged children. So we do it in Bumrungrad, and we help children who cannot afford treatment for their congenital heart diseases, right? Moving on. Okay, cardiogenetics. This is very important, and we have very special doctor. It is Professor Dr. Palakit. He's actually a cardiologist, but at the same time, he has the subspecialization in genomics and genetics. So he's amazing because it's very rare that you have someone who has like a genomic genetics specialty and plus another specialty in medicine. So he is amazing. And if you have any like patients with heart diseases which has genetic component, or you don't know about that, or they don't know about that, it's very important to start with our genetic center. All right. Anyway, they work together with heart center and treat patients. And for now, we have cardiogenetics and genomic services are very strong in our hospital, from prevention point of view and from treatment point of view. Okay, cardiac rehabilitation, very big thing because it's important after post-op bypass surgery or PCI patients. So we talking about like 100% success rate, right? Or compared to, for example, benchmark on 90. And it's important because heart patients, they need rehabilitation after. Not all this, all the centers they provided, we do. Okay, cardiac preventive cardiac imaging. This is we do like a normal health screening time, or we do it for the people with the some suspicious, right? And that's important. Screening programs are very important in our hospital to provide treatment for heart patients. Okay, this is all about Heart Institute. I hope it did not stop, right? It was okay. Hello.
Yeah, it was okay. Thank you so much, Dr. Law.
Okay. All right. So
Yeah.
let's maybe do one more center. I hope it will be same, same success
Yes.
like that. Yeah, hopefully
We cross our
we'll
fingers for
see.
that, yes.
Yeah, I'm very sorry that sometimes technology does not help us much. You know. Okay.
Yeah.
So for the all right, cancer. Let's talk about cancer. I think I will share after we finish. I will share our presentation so in PDF. So I think the anyone who attend the meeting, the training, so that they can just have the PDF and they can review it later. Okay. All right. Horizon Regional Cancer Center. So this is the center, the Horizon Cancer Center at Bumrungrad brings over 40 years of expertise. So we've been here for 40 years. And if you see, since 1990s, it was established as a cancer clinic, and then the Horizon Cancer was launched in 2007. And then we're having like a lot of different, sorry. Oh, sorry. A lot of different advances during the whole this time from the 2000 from the 1990s until now. So we were introduced in 2009. Targeted medicine was introduced, precision medicine. In 2016, we adopted a new next generation sequencing for precision medicine and personalized medicine. So we also incorporate 2017, we have multidisciplinary tumor board and molecular tumor board. And in 2021, AI, we start using an advanced technology for diagnostics. And for now, we trying to transition in the Horizon Cancer Institute, right, and set a new benchmark for clinical outcomes. All right, here you go. So we have 12,500 outpatients a year and nearly 5,000 inpatients a year. We treat all types of cancer, so anything. And this is our top five cancers treated at Horizon: breast cancer, lung cancer, colorectal cancer, head and neck cancer, and prostate cancer. Actually, it's a bladder cancer on the picture, but we will just pretend it's a prostate cancer, just like the stage. Then it's already those metastatic to bladder. So sorry for that. All right, moving on about the why Horizon Cancer Center. Why you should consider our center to send your patients here. First of all, we have like over 40 years of expertise. Second, we have specialized and personalized care for every stage of cancer. Third one, we have multidisciplinary team of experts here. And number 4, we have AI and cutting-edge technology integration here, including the next generation sequencing, including AI. And also number 5, precision medicine, because precision medicine is something very important right now in cancer care, with the tumor profiling, with the targeted therapy, with the immune therapy. All right, moving on about our services. So our team is quite strong. It includes medical oncologists, hematologists, bone marrow transplant specialists, oncology surgeons, radiation oncologists, pathologists, palliative care specialists as well. So if we only can offer palliative care, we will be open and we will say that to the patient. But even for the patients in terminal stage, we can offer something. We can offer at least palliative care. All right, for the precision personalized cancer care, so we have like a molecular tumor board with who will, they will discuss every single case and choose the right and the most effective way of treatment for the particular patient. So with systematic therapy, precision medicine, and advanced radiology. So of course we offer all types of treatment. We offer chemo, we offer targeted therapy, immunotherapy, radiotherapy. Also we offer comprehensive care for blood cancers, right, with stem cell transplantation, bone marrow transplantation as well. So, but in cancer, the most important thing in cancer is fast and precise cancer diagnosis. This is important. And expertise in precision diagnosis, cutting-edge technologies we use here, because we have comprehensive gene testing, we have flexible sample sources, so we can use all types, we can use tissue and blood samples, we can have rapid results because we have our next generation sequencing here on site to decode the genetic makeup of cancer. And also our labs are world-class labs, because for example, we're the only private hospital in Thailand certified by the College of American Pathologists, right? And plus genomic services, we're the only private hospital in Thailand with the genomic services using advanced next generation sequencing. Okay, so why it's important that we provide accurate and multi-dimensional cancer diagnosis. So to cover all aspects of the disease, every stage. So we can cancer staging, we can do cancer cell profiling, tumor profiling, right? We can do biopsy, which traditional biopsy, and also we can do liquid biopsy. It's a minimally invasive blood test that detects abnormal genetic materials indicating cancer. So it's a kind of advanced technology, and we can do it in our hospital. And also immunotherapy response testing as well, we can do in our hospital. So it's very quickly. So as I said, we have like molecular tumor board, we have Lunit Insight, precision medicine, we have all kind of comprehensive genomic profiling, we have all kind of machines for radiation, radiotherapy, radiology, with the Monaco for radiation treatment planning system, nuclear medicine. So everything is covered. Also, like Lunit AI, as I said, it has very high accuracy. So we have AI solution for chest X-ray and for mammography. So for the chest X-ray, so it can like 10 of the most common findings, right? It detects 97, 99 accuracy, so which is very high. And then for the breast cancer, it can detect 96 to 99% of accuracy. It can detect the nodules. So, and reduces the chances of missing cancer by 50%. It's actually amazing. It's an amazing system. It helps out radiologists a lot with the early detection of cancer. So here's our team of the specialists. So we have hematologists, medical oncologists, radio oncologists. Okay, and a little bit about outcome. So our actual clinical outcome quite good as well compared to benchmarking, right? Let's say, for example, for first year survival in breast cancer, depends on the stage. For example, in our hospital, on the stage 4 for breast cancer, our 1 year survival is 90%. Benchmarking 61. So it says a lot, right? And or for example pathologic complete response rate, right? So let's say if which we have 67% and benchmarking only 38. So it's for triple negative types of cancer, it's very very high. So I would say our clinical outcome for cancer treatments are amazing, and so you can be very confident sending your patients to our center. Okay, I think this is this is all about two centers, right? And introduction. Um, I think we have like 8 minutes. The thing is, I have one more presentation, but it's up to you. You can ask me questions, or I can cover neuroscience very quickly. I mean, I will try.
All right. Thank you so much, Dr. Laura. And that
What
was
do you think?
incredibly insightful on learning on the what Bumrungrad actually brings to the table, and also the Heart Center together with the Cancer Center. I think a success rate of 99% and also benchmarking an error of 0.2% against the 2% of the world is really incredible. And to all our partners on this call, this is exactly why Bumrungrad stands out, not only because of the medical excellence that they have, but because of also how your patients are cared for from the moment that they reach out. And with My One Health, you really do not have to manage it all alone. We support you with the referral process end to end, keeping you informed every step of the way. So we move to the next segment of the Q&A, where feel free to type in the chat or raise your hand if you have a question. I'll kick off with one, Dr. Laura.
Yes, yes, sure.
Especially on the cancer and heart conditions that you mentioned. For patients that require highly specialized or multidisciplinary treatment, like the advanced cancer or heart surgeries, how does Bumrungrad coordinate the level of care internally, and what's the role of the international team in managing this kind of expectations for the international patients?
Okay, for international patients, once they arrive, right, they're taken care of. I mean, even before that, right? Before that, we do pre-arrival process. If we're working with our partners, like you, for example, right, then if the or any third parties who refer to us patients, we of course work closely with the companies, right? So to make the pre-arrival part as smooth as possible, right? So you send the case, our referral team, they check the case. If the patient sends it by themselves, right? So if it's self inquiry, so we have medical inquiry team. So they will have the team of international doctors who coordinate with Thai doctors, right, and providing a treatment plan beforehand, before the patients come to the Thailand. So a patient will know what the doctor recommend to do, right? What treatment is recommended in this particular case, how long this will take, how many days the patient should stay in the hospital if it's hospital is admitting is necessary, right? How many days the patient should stay in Thailand after the procedure or in between treatments, if necessary. So if some documents or reports are missing from the patient side, the patients will be asked to send those reports, so for our doctors to see all reports, to see all evaluations beforehand, to make the plan as precise as possible. After the plan is shared with the patient will decide if the treatment and all conditions is actually suitable for him or for her, right? And then they gonna prepare prepare the trip. So on this side, that might be visa process. That's why some companies, somehow companies like you help with the visa process. But we as well, if everything needed from our side, we always help from our side as well. Especially if it's, for example, the patient already received the treatment in our hospital before, we can provide documents for medical visa, for example, as well. So then we prepare the trip, and then the patient prepared the trip. Once they arrive to Thailand, we have the representative office in the airport, where they will meet the patient. They will do the free transfer from the airport to the hospital. In the hospital, we have a team of interpreters if the patient needs it, right? So we have the team of interpreters to help the patient from each point, from with the doctors, with the any treatment. So they provide interpreting. Also, we have international doctors team who will be following the case as well. They, if for example, patients already admitted to the hospital, so we have interpreters visiting our patients. We have the international doctors visiting the patient, so to make sure the process, everything goes smoothly, and the all needs of the patients is covered, and the patient understands the process, understands the treatment, understands the what the outcome might be, because cancer, it's, let's face it, it's not very predictable disease, right? So sometimes we will try to do our best, but outcome has a lot of factors in outcome of each treatment. And again, after the treatment done, right, and the patient has to come back to, we follow up here, right, after the treatment, or seeing the doctor, or whatever the patient come to our hospital for. And after the patient come back to his or her own country, we do follow up as well with the patient. Also, we have telehealth, right? And the patient can schedule telehealth anytime with the doctor, right? To if they have any questions or problems or anything, to taken care of from our side, we have this option as well for the patient to follow up them. And we always follow up with the patient, especially if it's the treatments like cancer treatment or any complex treatments.
Thank you so
Okay,
much
I
for
think
that.
I answered, right? Okay.
Yes, thank you so much for that detailed response, Dr. Laura. I think I have two more questions.
Okay, sure.
One is heart transplant available for international patients? And if yes, what would be the estimate waiting time on the waiting list?
Oh, this is a hard question, because heart transplant, it's available for international patients. That's true, but there are some, of course, there are some terms, right? First of all, the patient should be registered to our heart failure program. So first of all documents should be sent to the hospital first, right? So our doctors, they will review the condition. Then the patient should be registered to our heart failure program. Then condition should be then the patient should spend time in the hospital with this condition, because we cannot just provide the heart transplant for anyone. It's not possible, of course. And also, once the patient registered to the heart failure program, once he's in the hospital already, the waiting time can be very vary, because it's we work together with Thai government, because it's everything regulated by government, not by our side, of course. And usually we send all the documents to the Ministry of Health, right? And it's up to them to approve it. So they might say, they might refuse documents. They did not do it before, but it can't be the case. So to guarantee, we only can guarantee from our side to prepare everything, right, to send to the Ministry of Health, sorry, of Thailand. And then we have to wait for heart. How long it will take, it's really vary, but from our experience from now, but you have to understand, it's very recent, right? We just started this recently, this program, so it was not more than 4 months. but it's after registered to heart failure program. I think it should be like the following up on this program and being in the hospital a few months, and after that, it's at least like a 4 months for wait for the transplant. Okay, I think I answered, right?
I think this is well
Hello?
answered. So
Yeah.
we can hear you. Yeah, I think it's well answered.
Yeah.
So there's one more question. I think we have run out
Yeah,
of
sure.
time, but there's one more question.
It's okay.
It's a question asking if there will be an exception for treatment plans, especially for patients who have imaging details that are between 8 to 10 months old. So is there like an exception on getting treatment plans for patients within the range of 8 to 10 months old records?
Oh, you mean any condition, right?
Yeah, any
Just the
condition.
little
Yes, yes,
kid.
yeah. It's a general
Yes,
question.
yes.
Yes.
Yeah, we have the 10 to 12 months, right? You said months,
Yes.
right?
8 to
Okay,
10
you mean
months.
yeah, babies, right? Yes, we have our children's center with very strong team of the pediatricians, and we cover pretty much all everything what you can imagine. We have congenital heart, we have the gastroenterologists for kids, we have neurologists, we have neurosurgeons as well for epilepsy, for all kind of treatments, for cancer as well. So yes, those age, yes, please send the case. Our doctors will see, and if we can offer anything, we will send the treatment plan. Yes.
Thank you so much, Dr. Laura, for that. I think we can conclude at that. Is there anything that Patrick might want to add, or maybe a follow-up question?
Oh, there are some questions there. Yeah, where is one question there? Oh, wait, but would be possible to me? Had cases we submitted. That was the question, right? That was required Oh, that was not the age of the patient. It was the imaging. I'm sorry, I misunderstood the question.
Documentation, yeah.
Oh, sorry. I'm very sorry. I'm very sorry. I thought you were talking about the children. I'm very sorry. I did not. All right. Okay. Okay. So basically, would it be possible to accept and process the sharing, especially for patients whose reveal include emission details only about 8 to 10 months? So you mean like if? All right. So here the thing. Some of the reports can we only can accept like it should be like 6 months, right? But if you have old reports, right, you can still share them, but it depends of the doctor. Some of the doctors they might refuse it and say they need like 6 months, because this is the 6 months is our protocol, right? It's a medical protocol, so we have to follow international protocols for that, especially if we're talking about some conditions with the quite rapidly changes in condition like cancer, right? So it should be like within 6 months. So, by the way, if you cannot offer those reports, right, I would say try to ask if the doctor can accept some details. But unfortunately, I think for some conditions probably not possible, because if it's what's the point to have a treatment plan for cancer which is like old report and maybe it's already metastatic? You don't know that. All right, so that's important to follow the protocol. But for some condition they might accept if you ask,
So it's
let's
just
say,
dependent
but
on the
maybe to ask.
doctor's
It depends on the doctor and condition. So
and
conditions
condition.
very
All right.
important. But the protocol, yes, 6 months. It's like standard one. We will ask everyone for that. Yeah, it should
All
be
right.
like not older than 6 months. So please try. And if your patient can do some tests in the country, right? Please suggest them to do it and send it to us, right? If not, maybe suggest, because sometimes doctor will say, okay, you don't have this report, this is too old. So the suggestion and treatment plan will be like, come to Bumrungrad and do this test. So it's up to the patient, right? But in this case, the doctor cannot do the full evaluation based on the report, right? Because the condition not really, the progression of condition not really clear for the doctor. Okay,
I think it's clear. Yeah.
so that's how you have to explain it to the patient, that, because it can be like 6 months, like 10 months. It will be big difference. Okay, thank you. I'm sorry, I didn't. I
No problem. No problem.
misunderstood the question. Okay, anything
Thank you
else,
so
or
much.
we can?
I
Okay,
think we
I
can
think I
close
will.
at that.
Yeah.
Yeah.
Yes, great. Thank you
So
very
thank you
much,
so much.
everyone. Yeah,
Yeah. Thank you so much,
thank you. I
Dr.
hope
Laura,
it
for
was helpful. Yeah.
the informative session. You can share the presentation as you mentioned before. Thank you to the attendees from My One Health, and also thank you for the partners that were able to join this session. Hopefully that we also have another session by Bumrungrad soon enough to explore the other centers and probably even hear the progress of the new center that is coming up. And yes, thank you so much, Dr. Laura, again, and your team for facilitating this session. And we look forward to further interaction. And hopefully we have more sessions with even more interactive questions to better understand the processes and also the requirements for patients. Thank you so much.
Okay. Yeah. Thank
Okay.
you. Bye bye. Have a lovely day,
Bye bye.
everyone.
Have a
Yeah.
lovely day.
Thank you.
Bye.
Bye.